When you go to the hospital, you're not supposed to get sicker, but in a very disturbing trend, more and more patients are picking up stubborn, dangerous infections in the hospital. One doctor is fighting back. He's using a common sense plan of attack. And as Christine Devine shows us, drugs have nothing to do with it.
My stomach was on fire. I was swelling up, just like you were inflating a balloon.
Doctor's words.
You are about to be in excruciating pain. And then he started cutting. I've missed graduations, I've missed weddings, I've missed 2 years of life.
If Alicia Cole looks familiar, perhaps you've seen her in this high-profile state campaign.
Childhood obesity. Don't take it lightly.
It's so ironic.
Alicia, best known for playing a doctor, now spilling the beans about her own medical nightmare.
Whew.
In August 2006, Alicia checked into St. Joseph Hospital in Burbank for minor surgery to remove uterine fibroids. Estimated stay 2 days. She didn't come home for 2 months. Now, almost 2 years later, she's still bandaged, still recovering from necrotizing fasciitis, also known as flesh-eating disease.
I'm enduring things I never thought I would have to endure.
All this the result of an infection she believes she caught in the hospital.
The bacteria is winning the battle.
The Centers for Disease Control reports 99,000 Americans die each year, and almost 2 million are sickened by hospital germs.
Hospitals are dirty.
Dr. Alfonso Torres Cook is head of infection control at Pacific Hospital in Long Beach. He has no involvement in Alicia's case, but shares her contempt for hospital germs. He was recruited to Pacific Hospital by Chief of Staff Dr. Luke Watson.
He hates infections. He hates people getting infected.
Dr. Cook's goal, make this hospital different. He told his staff
that we are not going to allow infections in our facility.
To make that happen, he set new policy.
You're breathing air right now that is clean.
To cut airborne infections, Dr. Cook ordered a germ-killing UV filtration system for the entire hospital. Next,
we emphasize from the beginning good hand washing, we emphasize good cleaning, and we emphasize the hygiene of the patient.
That's right, the patients. As soon as their admitted patients are scrubbed head to toe, even under their nails. Alicia says she wouldn't take that for granted during her month-long stay in ICU.
I don't remember being bathed.
A spokeswoman for Providence Hospital says it is the practice of St. Joseph to bathe ICU patients at least daily and as often as necessary, though the hospital refused to comment specifically on Alicia's case. Alicia remembers begging.
No, just take a washcloth and wipe me off. Just clean me off a little bit.
Alicia already had the super germ by the time she was transferred to ICU, so that's not where she caught it. But Dr. Cook says if her account is correct, she's not crazy to wonder whether a lack of bathing could be a sign of a hospital breakdown in infection control.
Sometimes it's part of our problem. We as a healthcare providers don't follow simple procedures. Hygiene.
Other mandates implemented by Dr. Cook, taking cultures before ordering antibiotics to make sure patients get the right drug for their germ. Patients who get antibiotics are served yogurt to prevent further infection. At the first sign of a new infection, an immediate investigation. Several months ago, when Dr. Cook noticed a small uptick in infection reports, he was able to trace it back to a breakdown in oral hygiene. From then on,
we brush their teeth, reduce the amount of bacteria that they might swallow.
The result of the teeth-brushing policy,
our infection dropped immediately.
Pacific hasn't had a superbug infection in 18 months. Its overall infection rate roughly 80% lower than the national average.
I'd say good for him.
Dr. Cook says Alicia's case is a sobering reminder of the viciousness of hospital germs and the importance of staying vigilant, even when colleagues have occasionally rolled their eyes.
There have been skeptics, but it has been 10 years, and now I'm no longer a lucky individual or someone who was crazy. You take care of yourself, all right?
Kudos to him. If we know that what we're currently doing isn't working, why not try something else? Why not try bathing patients? Why not try making sure there's no dirt under their fingernails when they come in the hospital?
Alicia wants to see Dr. Cook's policy implemented everywhere. Though her body's finally on the mend, she's still haunted by hospital memories.
Excruciating pain. We might have to take your leg. I went in a healthy person. for something that was minor.
Dr. Cook's message:
There is a simple approach to eliminate these problems in hospitals.
Christine Devine, Fox 11 News.
You might be surprised to know that hospitals are not required to report their infection rate to any public agency. Both Alicia Cole and Dr. Cook say that's a problem. We have more on what Alicia is doing to change the law on our website, myfoxla.com.